Hi, I am Rich Grossberg. I'm the medical director at the Hattie Larlham Center for Children with Disabilities in Manaway, and I've been in that role since 1999. But when I'm not at Hattie, I'm at the Center for Comprehensive Care at Rainbow. This is a multidisciplinary team that takes care of similar children that live at Hattie Larlham, except those kids live at home. They have in common the fact that most of them have cerebral palsy, they're in wheelchairs, and many of them rely on technology such as feeding tubes or ventilators in order to live. At our main campus, we have roughly 130 individuals that live there, and again, all very medically fragile. In order to provide that care, we are so fortunate to have really wonderful relationships with our local children's hospitals, including Akron Children's Hospitals and Rainbow. We have neurologists, pulmonologists, physiatrists, and today I want to focus more on our orthopedic relationship with Rainbow through Dr. Hardesty, who's on the call with me today. So, as I mentioned, the probably biggest common denominator of all of the children and young adults that live at Hattie is the fact that they have cerebral palsy and that they don't walk. And as a result of that, they have a whole host of orthopedic problems, including spasticity when their muscles are really tight, scoliosis when their spine is curved, something called hip dysplasia or dislocation, where their hips, as a result of not walking, can come out of the socket, leading to pain and discomfort as they get older. And then something that most people are not aware of, but children that don't walk have very weak bones and are prone to fractures. So you can see their orthopedic needs are massive. Dr. Hardesty really is this amazing sort of triple threat person that we have amazing access to. She actually comes to our facility several times a month in order to provide multiple orthopedic services. These include using Botox. Botox is not just for wrinkles. Botox was actually brought to the market initially to help with those tight muscles that I mentioned to you that occur in cerebral palsy. And she will provide this service right at our facility, so the individuals don't have to be brought in and out to local children's hospitals. She also can put in a device called a baclofen pump. This is a pump that gets implanted under your skin and has a catheter that goes around into your spine and delivers a medication that relaxes these kids' muscles so that they can be more comfortable. She does hip surgeries, spine surgeries. She's a national, maybe even international leader in this kind of field. And then, unfortunately, when we do see fractures, and fractures with these kids can even happen with routine care, she is right there and available to us to help manage these fractures. So we are extremely grateful to have her involved with all of our residents. This kind of ability and access is something that I could attest to. Most facilities around the country would not have anything on this level of engagement and involvement. So I am thrilled to have Chris with us and want to hear a little bit more about her experiences at Hattie Larlham and maybe help us to come up with some really good reasons to be generous for Hattie as a charity.
Well, thank you very much for that obviously paid endorsement. I'm Chris Hardesty. I'm a pediatric orthopedic surgeon. And since 2010, I've worked at Rainbow Babies and Children's Hospital. And since 2011, I have had both the honor and the privilege of being able to go to the Hattie Larlham facility in Manaway and see these kids, not only for all their needs, but see them where they live. Since the beginning of my career, I've also visited some other facilities to do the same sort of thing. And I have to tell you, there's absolutely no comparison between them. Hattie Larlham is far and away the most amazing facility who takes the best care of children in all of Northeast Ohio, if not the state, and maybe even the country. It's magical to be there. It's magical to see these kids and how they interact with the faculty there, with the nurses, with the staff, with the other residents who live there. and they get such incredible, amazing care. It makes my job very easy. I do get to help them with their musculoskeletal needs, but I know that when I'm done and they're back at Hattie, that they will be extremely well taken care of, and that every caution or prevention is in place to make sure that they recover well, that they are proactively and protectively monitored and managed. They live in the best possible environment they could live in. My husband and I became involved in the Circle of Caring a couple years ago, and now we both give as much as we're able to Hattie to continue this environment, this lifestyle, and this caring that goes on every day. I tell a lot of people about the history of Hattie and how one woman decided with one child to give what they could, to do what they could. And we hope that every day we continue to honor that legacy, and to continue to promote that ideal that every child gets as much as they possibly can. And we're confident that that happens at Hattie Larlham. And we're very lucky to have Rainbow Babies and Children's Hospital be a part of Hattie Larlham in this manner. Some of my other colleagues from Rainbow in other specialties come out and do the same sort of clinic. And then I get to have a really lucky and special relationship with the practitioners from Akron Children's who come out there. We are able to interact with one another to take the best care of these kids. It's really all around the best possible environment. So I'm going to just take a second here now and flip this back and say, Dr. Grossberg, do you have a favorite Hattie memory?
So that's a very good question. Now I'm going to flip this back to you when I'm done, so be prepared. So it's actually an interesting story. When I first came to Hattie Larlham, there was a young lady at Hattie who's non-ambulatory, has severe cerebral palsy, but she's fairly cognitive and can actually talk. And on rounds, the staff had asked me if I could meet with her because when she got really frustrated, she had actually bitten one of the staff members. And I remember sitting there doing rounds thinking, oh boy, I've learned lots of things, but I guess I didn't show up that day in medical school or residency when they taught me, how do you prevent somebody from biting someone else? So I did my best. I went in the room and I started talking to Rhea, is her name, and a little bit of it with a shaming quality, sort of saying to her, you know, you really shouldn't do that. You're not going to feel good about yourself. And Rhea started to cry. And this was a big moment for me. I felt bad about what I had done. But when I went home and I thought about it, it made me realize that even children who may be non-ambulatory, severely medically fragile, cognitively impaired, but inside, even though they're nonverbal, many of them understand what's going on. They have relationships with people and they're able to have feelings. And here in my little bit of scolding her, I was witnessing these tears, and really it reinforced for me that there is somebody inside. And this dramatically changed my approach to working with developmentally disabled children and adults who are nonverbal. And it was an important lesson for me moving forward. How about you?
I actually have two favorite moments. The first is the first time I ever came to Hattie and met Samaya. Samaya's smile will light up a room and there is nothing like it. And the second was the first time I ever saw Shane imitate you. Shane does a perfect impression of Dr. Grossberg. And I think we have a great video to show you exactly what that looks like.
Hey Shane, when Dr. Grossberg rounds, what does he do with his arms? He goes like that? Wow.
Well, I think there you have it. So I just want to say thank you to all of you out there who have joined tonight in an effort to raise some money for a worthy cause. We very much appreciate your interest and hopefully your generosity towards Hattie Larlham. So cheers to Hattie, and let's have a great night.
Cheers.